Hi there, everybody. My name is Dr. Marielle Conception. I'm one of the physicians at Big Trees MD, and my husband, Dr. Jeremiah Philo, also a family physician at Big Trees MD, and I have been working to put a cold and flu season primer together for you guys. That's a lot of facts, but please note in general, all of the information we're talking about can be found at bigtreesmd.com/cold flu. So that's COLDFLU, one word. So why do we care about creating this cold and flu primer? Because these are the most common things that we get questions on going into cold and flu season. And we wanted to bring to you the most up-to-date information about flu, RSV, COVID, because we're going to see it in our community. And there are actions that you can take that are going to help protect yourself and others. So what we are going to be covering today, again, I mentioned flu, RSV, COVID-19, how to prevent getting sick, and what to do if you get sick, and helpful links, as well as our vaccine clinic sign up. So we'll be talking about that. All right, let's start with the flu. This is definitely the respiratory virus of the bunch that people are the most familiar with. So it's probably duplicitous that I say that flu or influenza is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. So let's get into flu and the flu vaccine. So why get the flu vaccine? The flu vaccination has important benefits. It can reduce flu illnesses, visits to doctor's offices, and missed work, as well as school, due to the flu. It also makes symptoms less severe and reduces flu-related hospitalizations and deaths. Who is the vaccine for? So the vaccine is made for people who are 6 months and older, and there are very few exceptions as to who is eligible for a flu vaccine, especially for those people who are at risk. So young babies, as well as older people over 65, have either immune systems that are not fully developed or immune systems that are aging, and these situations create more susceptibility to flu. Also, those with weakened immune systems or compromised immune systems are actually those moms who are pregnant, because when you are pregnant, you have changes to your immune system, your heart, your lungs, and this makes people more susceptible to getting flu complications. Flu can also be harmful to the baby inside of mom. And also, going back to those who are susceptible to getting a more serious illness, those of any age who have chronic illness like lung diseases, asthma, heart disease, diabetes, kidney disease, and cancer. Going back to when to get your vaccine, let's talk about the duration of flu season. So flu season peaks usually December to February. However, we know that flu season is unpredictable. So right now we are not seeing flu that much in our community. However, the flu vaccine, it doesn't take effect immediately, and you want to strategize when you're going to get your flu vaccine so that you have protection when flu hits. For adults 65 years and older, there are 3 flu vaccines that are preferentially recommended. These are Fluzone High Dose, Flu Block Quadrivalent, and Fluad Quadrivalent. So if none of these preferential vaccines are available, any vaccine against flu is more helpful than not being vaccinated. Typically, a single shot is what's recommended per season. This can have a caveat if you are a child who is younger than 9 years of age, depending on their vaccination status. This is something that I would definitely talk to your doctor or non-physician provider about. When it comes to this season, the flu vaccine is available at pretty much every pharmacy. Typically, they offer vaccines as appointments as well as walk-ins. We are, again, at the end going to be mentioning the vaccine clinics that we are offering at Big Trees MD. So next on the docket is RSV. So RSV is something that we usually think of only in babies. We can learn from the last cold and flu season, where we saw by November of 2022, RSV was surging in children, and the RSV hospitalization rate for older adults was 10 times higher than usual for that time of the year. RSV usually causes mild cold-like symptoms. Most people recover in a week or two, but Like I just mentioned, RSV can be serious, especially for babies and older adults. And we see the data showing that RSV has become more and more severe in terms of the outcomes of what symptoms can lead to for RSV. The RSV season is typically from November to March. So, why get the RSV vaccine? The RSV vaccine is to help reduce symptoms if you get RSV and prevents hospitalization and death from RSV. In terms of who is the vaccine for, all babies up to 8 months and up to 19 months in some instances are eligible for Beyfortus. It's the new vaccine that is approved that is a one-time shot for RSV season versus Synagis, which is the previous vaccine that we had for only particular babies, usually those babies who were preterm and younger than 6 months, babies with chronic heart and lung diseases, and it had to be given every month. So people have said, oh, but isn't there already an RSV vaccine? There is. However, Beyfortus is the one that's going to be able to be administered for most children. Those 60 and above, especially those who are 60 and above with chronic illnesses, are candidates for this vaccine as well. When to get your vaccine, again, I mentioned RSV season can typically hit from November to March. However, it can become predictable when RSV hits. And we do locally have RSV vaccines for the adults. We are still awaiting the release of Beyfortus. A common question, can I get flu, RSV, and COVID vaccines, which we'll be talking about at the same time? Yes, there is no contraindication to getting all three. What I like to tell people is that when you get a vaccine, and we'll be talking about the science behind vaccines when we talk about COVID, but when you, like a kid who touches a grocery cart and then doesn't wash their hands and puts their hands in their mouth, they're going to get exposure to a lot more things than getting 3 vaccines. For those, especially who are watching local, we called and confirmed that Rite Aid and Angels Camp does carry the RSV vaccine, whether you call and make an appointment or you walk in. They're available at all Rite Aid locations. And again, Beyfortus is what we're awaiting still. It's been approved. We're waiting for it to be in doctors' offices. So one thing that I wanted to mention is for those parents who are awaiting the RSV vaccine, when RSV is in our community, just know that warning signs for RSV include difficulty breathing, blueness around the lips, fever that does not respond to Tylenol or Motrin. And again, I'm not everybody's doctor, and you should seek medical advice from your physician or non-physician provider, but Motrin is recommended for babies only 6 months and older. Going back to symptoms that you should watch for with RSV, very dry lips and tongue, and if your baby is not having any wet diapers and is showing dehydration. Those are warning signs that you should seek care emergently. So now on to COVID. So COVID in particular is the virus that gets people politically charged, emotionally charged. It hit us as a species so quickly. And even though there's a quote unquote end to the pandemic, what we do know, facts, is that COVID has been increasing in the United States since the summer months. So COVID is showing that it can affect us outside of the typical cold and flu season. One thing I like to point out is the difference between COVID and flu. Last month, it was reported in Epidemiology and Infection, a publication, that the risk of death from SARS-CoV-2 or COVID-19 Omicron strain was 4 times higher than from the flu. Historically, looking at flu and COVID, flu season is typically referenced by week number, so we can understand the timeline of the flu season in a given year. Now, with that, flu was tied to a yearly average of 15,654 deaths during the 2014-2015 through the 2018-2019 seasons, and then 7,851 deaths from week 33 in 2022 all the way to week 12 in 2023. So you can see that the number of flu deaths has decreased by season from 2014 all the way till the end of last cold and flu season. During the same period in that 22 to 23 time span, 32,607 people that were documented with COVID as the cause of death, it's probably more, died of COVID-19, or their deaths were related to the disease. So again, going back to flu in that same time period of 22 to 23, cold and flu season, 7,851 deaths. COVID, 32,607 known deaths caused by COVID. Again, in epidemiology and infection, the data showed that the risk of death from SARS-CoV-2 Omicron was 4 times higher than that of flu. So we'll get to myths and facts about COVID, but that is one that I want to point out just going into this discussion about COVID, because people think that COVID, oh, the pandemic's over, it's just the same as flu. That is not correct. So now, the new COVID-19 vaccine, and I say that new because we are literally at the cusp of this week that I'm doing this recording, the COVID vaccine for the 2023-2024 cold and flu season has just been approved. The vaccine, it's plural. So why get the COVID-19 vaccine? This is similar to the RSV and flu vaccine. The COVID-19 vaccine helps reduce symptom severity if you were to get COVID-19 and prevents the risk of long-term COVID, hospitalizations, and death. So I want to just pause here as we talk about COVID coming from natural immunity versus COVID protection coming from the vaccine if you were to get exposed to COVID. In general, when we zoom out as to natural immunity versus getting the vaccine, the additional benefit of vaccine-induced immunity is fewer downsides. And that's a very broad statement. Both immunity types, natural as well as vaccine-induced immunity, start to wane typically within 60 to 90 days, depending on how your body reacts. Getting the virus, natural immunity, comes with way more risks, including the potential to develop severe illness, long COVID, or death. These are not light consequences of natural immunity. Vaccination helps protect against the most serious risks. So when I talk to people who are parents, people who are adults, people who are teenagers, I get this vaccine hesitancy of, I don't want the COVID vaccine. So when we talk about vaccination, I want to focus here on that there are fewer downsides with getting the vaccine than not getting the vaccine. So when we talk about long COVID in particular, you're going to have a higher likelihood of getting long-term COVID if you are getting COVID without being vaccinated. Long-term COVID means ongoing respiratory, neurologic, and cardiovascular symptoms along with other symptoms, and these symptoms can last for weeks, months, or years following SARS-CoV-2 infection. Current estimates of long COVID incidence among non-hospitalized adults with COVID-19 range from 7.5% to 41%. Again, these symptoms can last for weeks, months, or years, and probably everybody knows at least one person who is suffering from long-term COVID. So getting a COVID vaccine is safer and more dependable in terms of building your immunity to COVID-19 than getting sick with COVID-19 without a vaccination. COVID-19 vaccination causes a more predictable immune response than the infection itself without a vaccine. And getting the COVID vaccine provides the person who's getting the vaccine, whether that person has not been infected with COVID recently or if that person has had COVID recently. That's something that people are not aware of because typically people were told if you have COVID, you're good for a few months. That's no longer the recommendations for getting the vaccine if you've recently had COVID. So there is also research that I want to mention that shows for people who already had COVID-19, those who do not get vaccinated after their recovery are more than 2 times as likely to get COVID-19 again compared to those who get fully vaccinated after their recovery. So important fact to know about COVID vaccination, especially for those who are thinking about, what if I just go without a COVID vaccine? I've already had COVID vaccines, my boosters, I'm good. COVID, just like any other virus, the goal of it is to survive in the wild. And when people are thinking that my COVID vaccine, I already had it done, I'm good to go, That was for that strain that we were fighting against at the time you got the vaccine. Now, the current strain that is out there, the dominant strain, is different from when we had the initial virus at the start of the pandemic, when the vaccines came out, and now. Just know that is a fact about all viruses, that they're trying to survive and they're going to evolve. And so our vaccines evolve. People are more familiar with how the flu vaccine is changed based on the H1, N1, H2, N3, whatever we have as components of flu. People are more familiar with that because we've had that disease, influenza, for a lot longer. But the same thing happens with any virus, including COVID. Who is the vaccine for? The vaccine is for people who are 6 months and older, especially those who have weakened immune systems, like adults over 65, young kids, as well as pregnant moms. So for the same reasons, those 3 groups in particular have compromised immune systems for different reasons, but those are the people that COVID vaccine is for, 6 months and up. Now, when to get your vaccine? You might think, oh, she's going to say, get it during cold and flu season. However, like I mentioned in the beginning of this COVID portion, COVID has been increasing since summer of 23. So COVID is not a virus that only exists during the cold and flu season months. So for our best recommendation is that with the COVID vaccine recently being approved, we expect it to be very much available in pharmacies as soon as possible. It might be available in the pharmacy sooner than our clinic at the end of September. So definitely consider getting the vaccine. It is tricky if you live in California, because vaccines for babies 6 months to 3 years cannot be administered in the pharmacy. And unfortunately, a lot of clinics do not offer COVID vaccinations. So definitely reach out to your public health department to see if there is a COVID vaccination clinic coming up that they're offering, along with reaching out to your doctor or non-physician provider about whether a COVID vaccination is available at your clinic. At Big Trees MD, being that my husband and I are physicians, we are planning to vaccinate for babies 6 months and up, as we've always done with COVID whenever COVID vaccine clinics have been run through Big Trees MD. We are able to vaccinate for those little ones. Okay, so fact or myth? This is probably the most beefy of the slides because it's a lot of stuff that's being covered. Just keep in mind that we have our website, bigtreesmd.com/cold flu. That's one word, where you can find a link to more myths and facts about COVID. So the first one I'd like to start off with is that you can get COVID from vaccines. That is absolutely false. None of the vaccines, Pfizer and Moderna, the mRNA vaccines that we have authorized in the US, contain a live virus. They do not contain COVID. None of the vaccines authorized for use in the US contain a live virus. So I repeat that over and over because that is like the number one thing that I hear from people, patients and non-patients, that you can get COVID from the vaccine, which is false. So going along with that myth being busted, this myth of getting a COVID-19 vaccine will cause me to test positive on a viral test. So if you have one of those at-home tests and you take it and you're like, oh, there's no way I have COVID, but I got the vaccine and now I'm positive, I must be the vaccine. Let's talk about how vaccines work. So vaccines work by delivering information to your body. And with that information, your immune system learns how to fight against the thing that the vaccine is trying to prevent against. If you can picture an egg with a shell that has perforations in it, like a strainer, and the yolk. And then the stuff separating the yolk from the shell is the egg whites that we know, right? So if you picture the yolk is where the DNA is, and the eggshell is where the outside of the cells are that things can go through to communicate within the cell, I want you to keep that example in mind. So with the mRNA vaccines like Pfizer and Moderna, the mRNA never enters that yolk. It never enters the nucleus of the cell where your DNA is kept. So later on in the slide here, I talk about I can have my DNA altered by COVID-19 vaccines, and that is false. And so COVID-19 vaccines allow the body to get messenger RNA. This is not the same thing as DNA. messenger RNA to go through those cells in the perforated or strainer-like shell, and it hangs out in that egg white area. It does not go into the nucleus where your DNA is kept. So when the mRNA brings information that the vaccine has in its components, the vaccine, the mRNA goes into that eggshell, and then the body says, "Hey, you're not familiar. Let me talk with you." And then the immune system pairs with that mRNA and creates an antibody. And that antibody is almost like a person is scribing or writing down the information learned from the vaccine and is holding it up to the rest of the immune system, and it goes out to the rest of the body outside of the egg shell. And those are antibodies that teach the immune system, hey, this is something that we have now new information about. We are sending out a newsletter that I've subscribed where I want the rest of the body to know that this exists, and we need to create an immune response to this thing that I just learned about. And here are the instructions to do that. So that's how vaccines work in general. They do not go into your DNA. They don't get passed down to generations. They don't affect fertility. Vaccines are meant to teach your body how to fend off viruses, infections, and with that immunity, with that learned immunity of, hey, now I know some information on how to fight off of a virus in this case. I have some tools in my body versus no tools to fight off infection such as COVID. And after the body is done with reading that information from the mRNA, the vaccine ingredients, they're no longer needed and they get discarded by the body. I will say here that addressing the concern that the ingredients in the COVID-19 vaccines are dangerous, COVID-19 vaccines, the mRNA vaccines that we have, do not contain ingredients like preservatives, tissues like aborted fetal cells, antibiotics, food proteins, medicines, latex, or metals. And so addressing later on that the COVID vaccine has metals so you can become magnetic. You cannot become magnetic from the COVID vaccine, and there are no microchips in the COVID vaccine. So I should say plural in the COVID vaccines. There is no metal and you cannot become microchipped from a COVID vaccination. So with that, again, I will highlight probably the most serious concern that is a myth that we get from people when they're choosing or not to get the COVID vaccine is that COVID versus natural immunity issue, where COVID vaccine, it's untrustworthy, it is new, it is not going to be as effective as natural immunity. All of those things are false. When you think about it, hundreds of millions of people have been vaccinated against COVID. And when you hear the one or two people anecdote of, oh, the COVID vaccine did this to me, I need to put a reminder here that we need to look at epidemiology. We need to look at global health statistics, not just my neighbor in my neighborhood of 5 houses or 300 houses. Statistics go beyond just our local community. And so that's a really important thing when I see people saying anecdotally, oh, I read on Google about somebody who had something. And do you know the exact medical history of that person? Their exposure status, their COVID status? There's so many unknowns. What we do know as a fact is that COVID vaccination is a safer and much more dependable way to build immunity against COVID-19 than getting sick with COVID-19. COVID-19 vaccine, like I mentioned earlier, can also provide a level of protection that is much better for those people who have just had COVID and then get vaccinated versus people who have not gotten the vaccine after COVID-19 infection. And just repeating that data, that those who had COVID-19 and did not get the vaccine after their recovery were more than 2 times as likely to get COVID-19 again than those who received vaccination after COVID-19 infection recovery. All right, so again, at bigtreesmd.com/cold flu, you'll find a lot of links, including one that talks about the facts and myths behind COVID-19 and vaccination against COVID-19. Now, when it comes to isolation guidance, this is a huge question that I keep getting over and over, and my husband as well. And it's a very valid concern because we know that, especially here where we're recording in Calaveras County, the adoption of getting the vaccine has been very slow. And so when we talk about, we know COVID is out there, or we know people who are sick and are not testing and they might have COVID, or they do test and they are positive and you were exposed to them, that is going to be an area where people are very concerned this whole cold and flu season. So with COVID worries in particular, if you are exposed versus if you are positive, those are two different things. So if you are exposed, you should immediately put on a mask and quarantine. And I will say here that masking, the reason why masks work, and I didn't have a slide for this, I should have, but masking prevents against droplet infection. So droplets are large pieces of saliva of what they're coughing out into the environment that hit the mask and don't go into your respiratory system. This is why having a high quality stock of masks, like N95 masks, is very good. This is why we continue to wear masks in the clinic, because COVID has not gone anywhere. And so we are taking care of people who are newborns to pregnant people, all the way to people who are older and have chronic illness, as well as by age, their immune systems are weakened. So if you are exposed to someone who you are suspecting or knows has COVID, put a mask on and quarantine. Stay home after the exposure, but before symptoms start is where quarantine is defined. In terms of isolation, once you're quarantined, it is recommended to isolate from those who might be exposed to your respiratory droplets, and you should have tests available 3 to 5 days after the exposure or the suspected exposure. And isolation especially is important if you have symptoms or if you test positive. How long does one isolate? So this is a really basic summary, and there is an excellent summary with more detail on bigtreesmd.com/cold flu. But if you are positive, stay home for at least 5 days and isolate yourself from others in your home. Try to use different bathrooms, close your door, have an air purifier going in your house as well as your room if possible. Use tools like someone puts the food at your door and you open the door and you take it from there. Much safer than masking and then removing the mask to eat with people in your home, if that is possible. After those 5 days, if you are positive, then it matters on your symptom status. If you've had symptoms and your symptoms are improving, you may end isolation after 5 days if you are fever-free or 24 hours without using a fever-reducing medication. If you've had symptoms and your symptoms are not improving, continue isolation until you're fever-free for 24 hours without the use of fever-reducing medications and your symptoms are improving. If you've had symptoms and you've had a moderate illness, you experienced a little bit of shortness of breath or you had difficulty breathing, you need to isolate through day 10. And if your symptoms were severe, you were hospitalized, you need to isolate through day 10 and definitely talk with your physician or non-physician provider before ending isolation. And you definitely should be using viral testing to help determine if you are still positive. But if that's not possible, then definitely discuss with your physician or non-physician provider. So regardless of when you end isolation until at least day 11, avoid being around people who are more likely to get sick from COVID-19. Again, babies, people who are pregnant, people who are older, 65 and older, along with anybody of those ages who has chronic illness like asthma, heart disease, lung disease, diabetes, cancer, those types of illnesses and diagnoses. In general, there is guidance on travel. So I definitely would recommend checking out bigtreesmd.com/cold flu so that you can read a little bit more on travel guidelines. I always mask in airports and in airplanes. There is data to show that airplane air is circulated and a lot better than an airport bathroom. However, I have asthma, and so for those people who have chronic illnesses and who can become very severely affected by having any virus, including COVID, it is definitely in your best interest to, when you're in an area where there is very poor circulation, so an indoors crowded space or an outdoors crowded space where there's not a lot of circulation. Like you could have a tent over the venue and there's a lot of people under the tent. That is still not the best circulation. So definitely consider wearing a mask when you're doing things like going to events like that, or going to the grocery store, going to the post office, things like that. And especially keep in mind that it's not a me thing. This is a community thing. So when you are protecting yourself, you're also helping protect others in the community. After you've ended isolation, even if you're feeling better and you have tested positive, you're better, you're not using fever reducing medications, your symptoms are improving, you should continue to mask through day 10. Or if you have access to antigen tests, you should consider using them with 2 sequential negative tests 48 hours apart. And that would help confidence level whether or not you need to wear a mask when you're going out, especially if you are the person doing the grocery shopping. In terms of where you go for the latest on COVID and COVID vaccination, again, bigtreesmd.com/cold flu, along with the website that I've put here, covid19.ca.gov. That is going to give you the latest data in terms of California. You can look for Calaveras County specifically, but in general, that California website is going to give you data on our state. All right, so here's another topic that is, I get less questions on it, but this is what we think about when we are hearing people are coming down with colds. So both COVID-19 and flu can have varying degrees of symptoms, ranging from no symptoms or asymptomatic to severe symptoms. So something to note, if a person has COVID-19, it could take them longer from the time of infection to experience symptoms than if they have the flu. So think about, if you get flu, you're going to have symptoms sooner than COVID in a lot of cases. I wrote here on the slide, for both COVID-19 and flu, 1 or more days can pass from when a person becomes infected to when they start experiencing symptoms of illness. It is possible to be infected with the COVID-19 and flu viruses without having any symptoms. So let's talk now about similarities. So similarities, these are not going to shock anybody, but you can have with both flu or COVID, fever or chills, cough, shortness of breath, fatigue, sore throat, runny or stuffy nose, muscle pain or body aches, headache, vomiting, diarrhea, change in or loss of taste or smell. So there are a lot of similarities. Of note, though, these last 2 symptoms especially can have some nuances to them. Diarrhea, which is much more common in children with flu, can occur at any age with COVID-19, and a change in or loss of taste or smell is more frequent with COVID-19 than flu. I put here also typically the differences between flu and COVID-19. Typically, a person may experience symptoms from the flu anywhere from 1 to 4 days after the infection, and a person with COVID can experience symptoms from 2 to 5 days and then up to 14 days after infection. So the duration of infection can also be a difference between figuring out, are you more likely to have COVID or flu? All right, so now we're going to talk about prevention strategies. Each prevention tool you use adds to your overall protection. As many of these things as you can do, great. Getting vaccinated absolutely reduces risk of severity of the infection from any of the viruses we've talked about, flu, RSV, or COVID, and it also reduces risk of hospitalization and death. Physical activity, it's so important to be physically active at all times. Typically, we recommend people who are able to get 15 minutes of cardiovascular activity if their health status can accommodate that every day minimally, so that you're pumping your heart, you're getting your blood flowing. This helps reduce inflammation in the body. This helps your immune system be healthy and ready to work when you need it to work. So being physically active is another key component to prevention of illness. Sleep and stress, these are definitely other pillars of lifestyle medicine that we like to talk about, because sleep definitely impacts your quality of your life, but also your immune system. when a person gets an adequate amount of sleep, it absolutely helps their whole body, especially their immune system, and inflammation levels not be so high. And stress also, whether that be stress from your work, your family life, whatever it is, stress can also create inflammation in the body, which makes the chances of an infection from any of these viruses that we've been talking about have a greater impact. Another way to prevent severity and illness is healthy eating. So, eating things that are from the earth, so grown from the earth or coming from trees, is always going to be the best guidance when it comes to healthy eating. So, things that are processed, things that are going to cause high inflammation, healthy eating is geared towards not causing an increase in inflammation and is very much opposite of processed foods. bigtreesmd.com/cold flu is where you can find more of these prevention strategies. And there you'll read things about masking, like we just talked about, using an air purifier wherever you can, washing hands. Regular hand washing is actually one of the best ways to remove germs and avoid getting sick and preventing the spread of germs to others. We, with 2 boys, we like to sing our ABCs to get in our 20 seconds. That is the recommended duration of time to wash your hands appropriately. Washing your hands, there is an actual technique to it. You're supposed to wet your hands and then put the soap on. Physical spacing is also very helpful because outdoor events, like I mentioned, they can, if you have significant spacing, can be a way to prevent getting infection. But if you are even outdoors in a close quarters contact, that's not always the best situation. So with that, we are going to highlight some helpful links. Flu, RSV, and COVID all have information on the CDC's website that is very helpful for different things, for knowing myths and facts about each of these types of viruses, but also the current data. Questions answered about vaccines are on there. And then for more trends and prevention on respiratory viruses in general, there's another site we have linked here along with bigtreesmd.com/cold flu. So now we're getting to our clinics. We are offering 2 clinics September 29th from 3 to 6 p.m. Now we expect to have COVID vaccines available. We do not know which brands will be available locally, but we expect to have them by this date. However, we put an asterisk here because they're pending availability. Flu vaccines are easy to get now. This is open to members as well as members of the public. If you are a member, you are more than welcome to share this information with your friends and family so that if they would like to get the flu and or COVID vaccines, they can make an appointment. It's for 6 months and up. It is free to all. And also another clinic is going to happen on October 20th from 3 to 6 p.m. What I did not put here and what is very important is that you must sign up by September 22nd to get a spot for the September 29th clinic, and you must sign up by October 13th to be eligible for the October 20th clinic. And you can find the links to sign up at bigtreesmd.com as well as bigtreesmd.com/cold flu. So with that long presentation, not too exciting, but very factual, contact us via our email, via our phone number that you can call or text, and then find us on, I made a mistake on our website. It's not our Big Trees, it's bigtreesmd.com. Thank you so much and stay safe this cold and flu season.